Panav, who will be talking about the modern day lenticular extraction techniques and how to get 20/20 on day one.
Thank you, sir, for the kind introduction. Okay. Good morning to one and all present here. So today I'll be talking on modern day lenticle extraction techniques and how to achieve 20/20 on day one. So as we know, there are multiple lenticle extraction based techniques present right now and the machines. That is basically it can be either a Smile, Visumax 500, Visumax 800, AIOS, Silk and Zymer. There are multiple machines available. Next slide. So I just summarized what all each of the machines, what is the difference between the machines available. So some of the machines do give cyclotorsion, but whereas some others do not. So it's tabulated in this table. But the main difference that you can see is the side cut. So the lenticule side cut is there in case of Visumax, in case of Silk, but there is no side cut in case of your AIOS and in case of your Zymer. So it's not just about energies when you're trying to customize it. As we know, customization is the key to better 20/20 vision nowadays. So while customizing, you have to customize the spot size, track distance, and pulse energy, all the three. And you have to make sure what is the cumulative energy. Cumulative energy is nothing but the energy that is required for the ablation. So how do we modulate these energies? So let's look at an example. First, there are two patients, similar power, similar topographies, underwent CLEX procedure. But during the operation, there was one patient who had a little tough dissection, whereas the other one was very smooth, provided both of them were done on the same platform. So the first one was, as all of us are seeing, the first I1 is having a tighter dissection when compared to I2. And similarly, even on post-op day 1, the first patient had a suboptimal visual recovery compared to the second one. So the main difference that we saw was not in the pre-operative state. We saw it was in the intraoperative state that happened. That was the tighter dissection. So that is one of the main factors that causes a decrease in the quality of the vision. And that's been published already, showing that different grades of extraction, the tighter the extraction, the quality does decrease. So will modern day indices help in predicting intra-op and post-op outcomes? So we have a AI-based software called as the AIOS2025 that helps us give us the Young's modulus. That is, it helps us to predict what is the post-operative stiffness of the cornea after surgery. So how do we use this software is with the help of the Corvus data and the pentacam data along with the epithelial thickness. So this is how the software gives us the report. It shows whether the stiffness it's a normal stiffness or there's a risk after surgery, risk of ectasia, whether it's a moderate risk of ectasia or the risk is higher. Based on that, you can customize which surgery you want, whether you want to go ahead with a CLEX procedure or a PRK is a safer bet. So based on all this, we also tried to quantify the OBL. So as you had seen, intraoperatively, there was some amount of difference in the two cases that we showed. So OBL was one of the factors what was contributing to this tighter dissection, and we tried to quantify it with the help of a software. And the BSA, that is the purple spots that you can see, those were the opaque bubble layer. So based on how much amount of those purple spots were there, we were quantifying the OBL layer, and we noticed that the grade of OBL that has been formed is directly proportional to the biomechanical stiffness of the cornea. That is based on the SPA1, CBI, and the thickness of the cornea. So as the values of the biomechanics keeps increasing, the OBL also does tend to increase. So even there was a correlation between the OBL and the grade of dissection. Higher the OBL, tighter the dissection. So that's why it's always better to see in patients like a patient with a thicker cornea with a stronger biomechanical index. We should counsel the patient initially itself that there is a chance on day 1 itself they may not get 100% quality in their vision. Quantity may be 100%, but the quality is what they have to wait a bit because their cornea is a little bit stronger. So coming back to the cases, So as we had seen that the case 1 had a tougher dissection when compared to the case 2, and the outcome was also 20/20, but the quality was lower. So let us go into the confocal microscopy. We can see, as we had suspected, in case 1 there was more amount of activated keratocytes and myofibroblasts. So the recovery was little slower in the first case, whereas in the second case the recovery was faster, hence the wow effect we had attained in day 1 itself. So every eye is unique, so should our customization be. And based on that, there are few cases. So the first case where there was a normal topography with TCT of 540 microns, and as we can see, the biomechanics is also quite strong, and the SPA1 is 131, which is a very high grade of biomechanical index. Even the acusamic showed it was a normal corneal stiffness. So when we started customizing these energies, we saw that in Silk 1, we cannot customize the track distance and the spot distance. We customize based on the energy, that is lenticular energy in the anterior, posterior, the ring energies, the entry, all those based on that. So tougher the cornea, thicker the cornea, stronger the cornea, you need to increase the energy a little bit. Yes, OBL will increase a bit, but you need to take that chance, because otherwise the dissection will get tougher. Whereas in cases of thinner or little less stronger corneas, where the biomechanical index is not in 130s and it's at least only 90 or 80, you can come a little lower. You can reduce your energies. The second setting is that of AIOS, where we can change the energy settings based on the energy levels, spot distance, and track distance. So similarly, coming to case 2, as I just now said, where the biomechanics is not that strong, it is coming to the borderline mechanical indexes. So when we try to customize this, we will go a little lower. We will reduce our energy settings. In case of the energy levels, we will increase the spot distance and the track distance. So as we know, it is based on the femtosecond principle. It works on the photo disruption method. So the amount of energy that you are applying, that energy will dissipate and form the OBL bubble. So you need to increase the track distance and spot distance in order to have the lesser impact of the energy. So this is how we can modulate if it is based on Silk platform. Right now we can even modulate even lower energies, because Silk platform is allowing us to go up to 40, but I think some other surgeons have already started going lower than 40 also. So thank you.
Thank you for that very nice presentation. So do you think are you all coming up with any kind of nomogram based on biomechanics to alter energies specifically, or?
So
right
we are working on it right now, so it's still under process actually.
So for higher treatments, generally, because I am working on the ELITA platform, I have different energies for a cutoff of say 4 diopters or less, and then higher than 4 to 6 or above 6. So that does tend to help, because the laser is firing deeper in the cornea, and of course it's going through a thicker cornea sometimes, so then you do require higher energies to make the dissection better. Generally the OBL, if the energy is optimal for that particular cornea, you won't get excessive OBL in that situation.
Yes, yes.
I was just going to ask, because I think you have the ELITA platform, whether does the corneal pachymetry or whether the diopter or the K value, do you change it according for the energy or the spot size?
So that's what we are working on it, but yes, if we see a SPA1 and the acusamic showing a very strong cornea, that is 131 and all what we saw in this patient, then yes, we do change it.
You decrease
No, we do increase it.
increase the spot size but decrease the energy.
Yes. No. So we increase the energy, we decrease the spot size.
Very nice presentation. I have, for a number of years now, if I have corneas that are above 580 thickness, I don't have all of the lovely diagnostic tools that you have access to. Above 580 microns, I always counsel to increase, and this is with the Visumax laser, which is the one that I have access to, by 1 step, which is 5 millijoules, and to do that across the board. And that definitely makes the lamellar dissection, because of the density of the keratocytes, makes the lamellar dissection so much nicer. and definitely the results, I agree, on post-op day one are a lot better. So thank you so much.